Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, May 25th, giving you the update from Albany Med. All right, Fred, white coat brigade today.
Yeah, white coats.
We got coats today.
Yep.
All right, let's pop open the first graph. Capital Region, 8 counties. Currently, people in the hospital diagnosed with COVID, 55. The high for the region was 553, so 10%.
10%.
10%.
Keeps trailing down.
As it does on the next graph, New York State, 1,357. That came down from a high of 18,000, so
right.
Moving in the right direction. Next one is sort of fun. This is Albany Medical Center, admissions and discharges. And Fred, there's something very interesting in the last 7 days. Why don't you tell everybody?
3 of the last 7 days, we've had no admissions.
Right.
No COVID admissions.
So three days without any COVID admissions in a week would be the first time. It's got to be
First time that's ever happened, and 2 back-to-back days with no admissions
which
as well.
is great.
Yep.
All right, and then the last graph here. So what is currently at the medical center? Morning census, we have 14. 2 of them are in the ICU. 1 of them is on a ventilator. And Fred, how many no longer infectious?
3 are no longer
3.
infectious, so just 11 sick still.
You know, Fred, somewhat of a non sequitur, but just a shout out there. There was a patient that the medical center cared for a couple months ago, very, very sick, was in CPS. And that individual was on ECMO. And that individual ultimately was transferred to the Cleveland Clinic. And I know that those that are watching who cared for this person must know that, but that person has been discharged from the Cleveland Clinic.
He was sent there to be considered for a lung transplant.
Right.
And yes, we heard just today, as a matter of fact.
But the cases of people who get on ECMO, which is an extraordinary event, who actually pull through and survive, are not that common. So an incredible credit to the medical center and that team in CPS.
Huge effort. I think he was in CPS on ECMO for more than 45 days.
Yeah, congratulations.
Yeah, good job.
All right, let's flip the script a little bit. Let's talk about vaccines. Again, very good numbers. Capital Region, those same 8 counties. Those that have received a first dose of a vaccine, we're now up to 629,000, which is 58% of the total population. If you look at those 18 and above, 69%.
That's great.
And then here's a really cool statistic. If you look at the people who have completed the vaccine series, we're at 50.6%, and we are the only hub in the entire state that's crossed over 50% having completed it, which is great news.
Tremendous effort. It's really fantastic.
So congratulations to everybody involved in that. Fred, another number that you and I spent a lot of time talking about, transfers. So let's talk about that for a second. The medical center, of course, has as its mission taking in people that no other hospitals can care for.
That's right.
I'm sure we've mentioned these numbers in the past. Last year, over 16,000 transfers came into the medical center.
That's right.
Something curious has happened recently when it comes to the people being transferred into the medical center.
So Dennis, Rutland, Vermont,
right.
Plattsburgh, Messina, Ogdensburg, Canton, drop down to Utica,
right.
Ithaca, Binghamton, Newburgh, Pittsfield.
Now, if this was Jeopardy, I'd say, what are places not in the capital region?
You'd be right, but those are all places where in the last 10 days we've had transfers from. And Ogdensburg is on the St. Lawrence Seaway.
Right.
It's 223 miles away. I had to look it up. But they couldn't get services either at the hospital locally or the traditional referral center, which is upstate in Syracuse.
So you and I have been looking at transfer numbers here for probably 15 years. We do know that in the past, occasionally we would get transfers, but what has really been sort of eye-opening is the volume and the increase in transfers from those areas.
That's right. I think in the last 10 days, we've had a call from Plattsburgh almost every day.
Right. And what do you think is driving that, Fred?
So I think that the traditional referral lines, so Plattsburgh, for example, is part of the University of Vermont health system. UVM in Burlington is full. And I think they're having some staffing issues, as is Upstate and Bay State in Springfield. And so they're not able to service their traditional referring facilities.
So I know that you and I share this philosophy that, when the transfer center gets a call, which of course is staffed 24/7, we do everything we can to try to say yes as often as we can, which is almost every time, to take transfers in to care for those people. And they're coming from farther and farther away, and that's because those areas apparently are having a harder time doing what they normally do.
That's right.
Increasingly turning to us to care for those people. And of course, it's our staff in our ICUs, in our EDs, on our floors that are caring for those patients.
So Dennis, I think we're going to get a group together to see if we can't sort of spread this a little bit across our network.
Right.
You'll recall that when
Right.
we took COVID transfers out of Queens,
Right.
we actually not only took them here at the medical center, but we took them at Saratoga,
Right.
Glens Falls, and Columbia Memorial.
We sure did.
So we're going to look at strategies. Can we serve those far out regions through a system approach?
I think that's fantastic. So the Albany Med Health System, a regional transfer center,
got it.
which would be fantastic. So to everybody involved in that business, the people in the transfer center, the people saying yes to those transfers, the people caring for them, we thank you. It's very
Thank you very
important.
much.
And I'm sure the families of the patients being sent here,
Very
thank you as
grateful.
well.
Very grateful.
We do know that in the summertime months, Fred, you were talking about this morning, the requirements for blood goes up and blood
right.
transfusions goes up. I was very fortunate last week. I was able to go down to the Albany Capitol Center and donate blood with the American Red Cross. And Fred, I know you donated today.
I donated today. There's a blood drive going on right now in F309 in the F building. We do this 4 or 5 times a year.
Yes.
You know, it's our staff that go there, and I've seen a couple of people walk around with little Band-Aids on
Right.
their arms, and I've thanked them for donating blood. So it's too late to donate by the time you see this video, but think about it the next time they're here.
Yeah. So there's the app, right? The Red Cross has the Rapid Pass.
That's
you can
right.
schedule appointments. You know what's fun with that is nowadays you can see your COVID-19 antibody results
right.
come back.
That's right.
Yeah,
And
shows
you can
the-
also see where your blood goes.
Which is very interesting,
Yeah,
right?
yeah,
So
very
my
interesting.
blood went to XY. So to everyone who's donated, thank you.
Thank you.
Fred, yesterday we had an Eye Care Award winner.
That's right, we did.
You want to take that one?
So it was Susan Wayner, who is the support to the foundation.
Right.
Just a tremendous employee here at the medical center. The accolades about her performance were just really incredible. And there were a few little tears in the audience
Yes.
when she got up and talked about her commitment to the organization and to the foundation.
Yeah.
It was
They-
really good.
They called her the glue.
The glue,
That held it all
that's
together.
right. Susan the glue.
So we congratulate her. And we had another Daisy Award winner, and so we'll pop that picture up there. So this is Odasia Burton Garland, and she works in VIR, Vascular Interventional Radiology, a very interesting and cool place in the hospital. Does some very high-end procedures.
Really neat things.
Yeah, and the nurses are an incredibly important part of that. The write-up on her talked about a family member who couldn't get in to see a loved one. It was after her shift. She went out of her way to make sure that they got connected. You know, really sort of going the extra mile.
It illustrates, Dennis, who we are.
Absolutely.
Great.
All right, I think that's the update for today. Now, anything on Thursday that we're going to be talking about in particular or not?
I think we're going to talk about length of stay.
Okay, thank the stay. We'll talk about that. And of course, we'll get some updates on what's happening with the vaccines and everything else that's going on at the medical center. So we'll be back again in 2 days. We ask that you once again, please take care of yourself, take care of each other, and we'll see you on Thursday.